For decades, surgery has been defined by the skill of the human hand. Precision came from training, repetition, and experience. But a shift is happening inside operating theaters around the world. AI is beginning to reshape surgery by improving the parts of the process that humans struggle with most: seeing clearly, predicting risk, and navigating complexity in real time. They're not taking over the operation. They're giving surgeons a level of information and precision that simply wasn't possible before. The first place this is happening is in imaging. Surgeons rely on visual cues, but human vision has limits. AI-enhanced imaging systems can analyze live video feeds during procedures and highlight structures that are difficult to see, like blood vessels, nerves, or tumor boundaries. They can differentiate tissue types based on patterns invisible to the human eye. And they can do it in real time, without interrupting the flow of the operation. The surgeon is still in control, but the field of view becomes richer, clearer, and safer. Before surgery, clinicians rely on scans, notes, and experience to predict what they'll find. But anatomy varies. Disease reshapes structures. No two patients are the same. AI models can now take preoperative imaging and build detailed, patient-specific maps that predict where critical structures are likely to be, how tissue planes will behave, and where complications are most likely to occur. It's not guesswork. It's pattern recognition built on thousands of previous cases. Surgeons describe it as going into the operation with a clearer mental model, not of a generic patient, but of the one in front of them. Modern surgical robots aren't autonomous, but they are becoming more intelligent. They can stabilize instruments, filter out tremor, and maintain precise trajectories that would exhaust even the most experienced surgeon. AI systems can warn when the surgeon is approaching a sensitive structure and adjust the robot's movement to maintain safety margins. The surgeon remains the decision-maker, but the robot becomes a partner that enhances stability and precision. We're also seeing AI used to predict complications before they happen. During surgery, subtle changes in tissue behavior, bleeding patterns, or instrument resistance can indicate rising risk. Humans can miss these signals because they're small, fast, or counterintuitive. AI models trained on thousands of hours of surgical video can detect these patterns and alert the team early. AI in surgery isn't about automation. It's about augmentation. It gives surgeons better information, better visibility, and better control. It reduces cognitive load in the moments where precision matters most. And it helps standardize quality so that outcomes don't depend solely on where a patient happens to live or which surgeon they happen to see. There are constraints. AI models must be trained on diverse datasets to avoid bias. They must be validated rigorously before being used in the operating room. And they must be transparent enough that clinicians understand what the system is doing and why. Safety, governance, and accountability matter, especially in environments where decisions have immediate consequences. Surgery is becoming more data-driven, more precise, and more personalized. Not because machines are taking over, but because they're giving clinicians a clearer, more reliable view of the patient they're trying to heal. The surgeon's skill remains central. AI simply extends what that skill can achieve. This is the quiet transformation happening in operating theaters today. And it's one of the most meaningful shifts in modern medicine, the combination of human expertise and machine intelligence to deliver safer, more precise surgical care. If you liked this video, consider subscribing for more deep dives into the tech shaping our futures.